The next source of chronic inflammation and toxicity that we'll speak about are root canal teeth. And this is quite a hot topic right now. You may have seen the New York Post or Daily Mirror, where I said I was one of those dentists. This is one of the things that I would never do. And full disclosure is when I came out of dental school, I thought root canals were great, right? Where dentists are in the business of saving teeth. And here, we're able to save teeth. In actuality, this procedure is flawed. By the way, most modern root canal evolved and was introduced shortly after World War II. And there were materials used to fill the canals of the roots. And here you can see on the left is a healthy tooth with a healthy pulp, okay? Your tooth is similar to an organ system. It has a skeletal system of enamel and dentin and cementum, which is a tiny coating on the roots of the teeth. It has a circulatory system, tiny capillaries and arterioles and venules, this dynamic blood supply inside the center of the tooth. It has a nervous system, right? With a nerve, and we all know that if you have a toothache, that nerve is pretty closely connected to a branch of the fifth cranial nerve, the largest nerve in the human body off your spinal cord. So, and it has a lymphatic system. So it is a living, breathing organism. And when you have a deep cavity, this pulp can die, causing this abscess. And here you see the death of the internal part of the tooth and this abscess remaining. And the idea was to clean out these canals down to the abscess and create what we often called a hermetic seal of these roots. Here's the clean root canal filled with gutta percha. So we clean out the inside and then we fill it. Sounds like a good tissue, a good treatment. And those in the profession that say that root canals are good and it's a tooth-saving therapy, they claim enough of the tissue is removed, the body's immune system can get on top of any existing infection. There are improved substances to fill the tooth. By the way, they even used a form of formaldehyde when they were originally doing these, just like embalming a dead body. By the way, root canal is the only procedure where we keep something dead inside you. And they say that, oh, there's no other suitable options to keep the tooth. However, dentists who speak against the safety of root canals bring up three major concerns. One, there is no way to completely sterilize the tooth, to completely remove all the dead tissue from the tooth, no way to sterilize the tooth, thus leaving potentially harmful bacteria in the dental tubules to continue to propagate. And here's the key word, produce endotoxins. 100% of root canal teeth in one study of root canal teeth that were extracted had endotoxin production. There were endotoxins being produced. And the materials used to fill the hollowed out tooth do leak and cause problems downstream. There was a movie called Root Cause on Netflix about a root canal causing harmful, really nerve-wracking and debilitating systemic problems on someone who had to have a root canal, and he did not know that the root canal was causing his systemic problems. And the American Association of Endodontists filed a class action lawsuit to get Netflix to pull that movie down, even though the movie had a lot of factual scientific information that people should be aware of. So the fact is says there's no evidence that root canals could be linked to cancer and other inflammatory diseases. Well, that's not really true, because we look at, here's a study from 2007 on the effect of root canal procedures on endotoxins and endodontic pathogens. So, and this is pulled right from the study. If you look at results, endotoxins and bacteria were present in 100% of the initial samples, with endotoxin concentration ranging. And this was even after 7 days of the chemomechanical treatment we use to disinfect the tooth. Here's another study on the dynamics of root canal infections, that chronic asymptomatic inflammatory lesions around the apex of a tooth with a necrotic dental pulp or an insufficient root canal, that there are all kinds of chronic asymptomatic inflammatory lesions that can develop that often go unnoticed and remain for years. This was the documentary Root Cause. I think you can find this on YouTube, but it was an interesting movie that was produced by an Australian producer who was actually the patient who experienced this, and it motivated him to make this movie. So root canals have this issue. Excuse me. Oops. Okay. Sorry here. Trying to get out of. Okay. Sorry about that. We just lost a little bit of. We're going to get back here. I'm trying to get this box off. Sorry, everyone. I'll be right back to where we were. Love technology. And we're going through. So, 1 second. Hey, everyone. Thanks for your patience. So, root canal paths of inflammation and infection. This is also very important for everyone to realize that the infection can be inside or outside of the root canals, that the extruded root canal filling material causes a chronic inflammatory immune response. Many dentists even tell the patient, oh, it's good. It went a little over the end of the root. It's really sealing it. But no, it causes a chronic inflammatory immune response, just like a splinter in your finger. There's an accumulation of cholesterol crystals that can irritate the tissues. There's also cystic lesions where the root canal is done. Very often, cystic lesions form where the root canal is done. And there's sometimes scar tissue that can be irritating and inflammatory near the root canal site. And, here we're looking at what we call a histological look at what's going on with the extruded root canal filling material. So the end of the root is here, and all this stuff here is extruded from the end of the root. And you can see all these inflammatory cells around it, causing a chronic inflammatory response. This is an actual root canal tooth that I extracted with a cyst around the end of it. Very often, the patient was complaining, this often goes, this is a giant cyst on the left. By the way, this is not the same tooth, but this, I've seen cysts as large as this and as large as this forming where a root canal is done. And this is perhaps the most ludicrous procedure, where we put dental mercury on the ends of a failing root canal. So you can see an infection here, and the endodontist is doing something called an apicoectomy, where he puts this mercury around the end, and then they redo the crowns. This is toxic. Let's look at another toxic substance, BPA containing composite resins. It's bisphenol A glycidyl methacrylate. This tooth-colored filling. Often, patients had their amalgams taken out and they had tooth-colored fillings put in. They had the amalgams taken out unsafely, and their dentist put in tooth-colored fillings, which look nicer, not understanding that you're going from the pot to the frying pan. As a matter of fact, there was a 2012 study on 434 children who had their cavities filled with a white composite resin known as bis-GMA resin. And they were developing small but quantifiable drops in psychosocial function. Treated kids became more moody, aggressive, and generally less well-adjusted. toxicity in the mouth, effects in the body. So BPA has always been a nasty chemical, from plastic water bottles to all kinds of applications and use, including plastic fillings, composite resin fillings. They have been linked to breast, prostate, neuroblastoma, ovarian cancer, even reproductive anomalies with ovarian development, heart disease, diabetes, and really abnormal growth. So about close to 8 years ago, I was championing the introduction of BPA-free, non-BPA, tooth-colored restorative materials. This is one good one. I put it in there because I tell patients, ask your dentist if he uses this. This is made in Germany. I have no commercial connection to this company, and it's a composite resin. That's an alternative. Let's talk about sleep apnea and what that has to do with your mouth. 75% billion people on the planet, 75% of severe cases are undiagnosed. And 1 in 15 adults have it, 25% of middle-aged men, 1 in 5 at least have some stage of sleep apnea. Sleep apnea is your ability to breathe. There are 3 things we need to survive, and that is food and water, oxygen, and sleep. And if we don't get those, it's linked to everything, not just daytime drowsiness and increased number of motor vehicle accidents, but everything from depression, diabetes, stroke, heart attack, hypertension, type 2 diabetes, I did say that, and memory loss. The common treatment for obstructive sleep apnea is this device called the CPAP. And CPAP is an appliance that you wear at night that forces air down into this area in the back of the throat where the tongue may be too far back. And we see this whole, a lot of people don't understand that your tongue is this entire organ here. And many people have large tongues and their mouths are too small, forcing their tongue further back, restricting their airway and condemning them to sleep apnea. So CPAP, if forced air, is treating the symptom and not the root cause. So when we treat the symptoms of sleep apnea and not the root cause, long-term, this can be very debilitating, stretching out the muscles, ligaments, and tissue in the airway, the equivalent of blowing a balloon up too many times. If you don't wear this device, which doesn't correct your sleep apnea, it alleviates it. If you don't wear this, you're at greater risk of heart attack, stroke, and all those other systemic ailments from long-term use of this. So how do we correct it? One of the ways that we do in our office is we give everyone, by the way, everyone should get, I don't know if we have, everyone should get a home sleep study. We can actually send them out if you contact our office. It's a simple test you do in your own bed, and it gives us 8 pages of data on whether or not you are suffering from this condition, which is a source of chronic inflammation. By the way, sleep apnea, many people breathe through their mouth. They're not breathing through their nose. They're not generating nitric oxide, which is produced by the microbiome in the sinuses as well. So this appliance actually helps. It's a removable appliance that helps with increasing the area of the oral cavity. So a friend of mine wrote a book, 6-Foot Tiger, 3-Foot Cage. And it was a great title because the 6-foot tiger is your tongue and 3-foot cage is your mouth, especially if you've had orthodontics and you've had teeth pulled to make your teeth straight. It actually shrunk the cage. Remember, the cage is your mouth for that big organ called the tongue. So if you're tongue tied and your tongue is tied and it's further back in the back of your throat, that can exacerbate or cause obstructive sleep apnea. If you have a high vaulted palate as well, very often we see tongue-tied with high vaulted palates where there's not proper flat palatal formation. So the arch is narrow and the tongue does not have good posture, and it restricts your airway. It restricts your ability to breathe. So this appliance is used, and you can see someone on the left here. We just had a case almost identical to this case where before the appliance and after the appliance. And then you see down below a CBCT. This person is breathing through a coffee straw here on the left. And after treatment, they have natural breathing. They do not need to wear a CPAP any longer. Research has revealed 80% of individuals who have sleep apnea are unaware. And 75% are undiagnosed and untreated. Many dentists don't check for this as well. So very, very interesting that children often suffer from this. From when they're born, they can be tongue-tied. Now we check for tongue-tie in the hospital. And by the way, bedwetting and ADHD are related to sleep apnea. Very, very interesting. When the brain needs oxygen in your sleep because you've stopped breathing, it looks for oxygenated blood anywhere, and very often around the bladder, there is oxygen-rich blood that isn't actively used during sleep, which affects continence and bedwetting in children, which has often been called a readiness issue. So here's what I want everyone to know, and that we do virtually with our patients all the time. We can send you, we do an initial consultation and screening on a Zoom call. We have you get a diagnostic image called a CBCT. You could do that anywhere. Most communities have a doctor who has a CBCT, an oral surgeon or dentist who has one of those. They're getting more commonplace. And then we also send you this home sleep study, which you wear. There's a little sensor on your breastplate, your finger, and your wrist.